my name is Evelyn, and this is going to be a neurological assessment. And the patient has already denied any history of seizures or neurological conditions. She's denied any changes in mental status, drowsiness, any history of head injuries, and is oriented to person, place, time, and situation. Okay, so moving on, we're going to start with a cranial nerve assessment. So we're going to start with your olfactory nerve. So I'm going to have you close your, actually you can leave your eyes open because these are unmarked. If you could block one nostril for me and tell me what you smell.
Coffee.
Very good. And block the other nostril.
Coffee.
Okay. And then block a nostril for me.
Mint.
Okay.
Mint.
Okay, good. And to assess the second cranial nerve, the optic nerve, we would do the Snelling chart, which we've already completed, and she has 20/20 vision and no visual deficits. So now moving on to cranial nerves 3, 4, and 6, I'm going to have you assess the 6 cardinal fields of gaze. So I want you to follow my finger, okay? Very good. And keep your eyes on my finger. Okay, good. And the pupils are converging, so that there's good convergence. And if you could close your eyes and open them, good. There's no eyelid drooping. They're symmetrical, and pupils are equal, round, reactive to light and accommodation. Okay, so now for the trigeminal nerve, I'm just inspecting for any muscle atrophy, tremors, and then I'm also going to test sensation. Okay, so I just want you to let me know when you feel something. So close your eyes.
Yes, I can feel it. Soft. 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 Soft.
Okay, and also for the trigeminal nerve, I'm going to have you can open your eyes and clench your jaw. Good, and I'm feeling for muscle tone and strength. Any pain, tenderness there? Okay, and there's good muscle tone and strength. Okay, and moving on to cranial nerve 7, I've been assessing facial symmetry, and now I'm going to assess some facial expressions. So if you could smile really big for me, good, and if you could kind of clench in for me, and then frown. Okay, good. And so, again, looking for symmetry. And I'm also going to, for this assessment, have you taste some things. So if you could stick your tongue out, tell me what you taste on the side of your tongue. Anything?
Bitter.
Okay. And then tell me what you taste.
Salty.
Okay. And then one more. All right, stick your tongue out.
Sweet.
Okay. And then stick your tongue out.
Sweet.
Okay, so the taste on the sides of the tongue is intact. So moving on, we're going to test hearing for the acoustic nerve. So I want you to let me know if you can hear this sound in both sides of your ears equally.
Yes, it's the same on both sides.
Okay, for the next one, I'm going to put this next to your ear, and you let me know when you cannot hear it any longer, okay?
Yeah.
Okay, and for the sake of time, that was 30 seconds.
Now.
Okay, and normal bone conduction sound is 30 seconds, so your hearing is intact. Okay, so now moving on to cranial nerve 9, I'm going to test your taste again on the posterior third of your tongue, so if you could stick your tongue out, tell me what you taste.
Salty.
Okay. Tell me what you taste.
Sweet.
Okay, great. And tell me what you taste.
Bitter.
Okay, very good. And during that assessment, I was also looking at the uvula. It's rising symmetrically, the palate's symmetrical, and that's cranial nerve 10. And I'm also going to do the gag reflex. So if you could stick your tongue out. And the gag reflex is intact. I'm also noticing speech to assess cranial nerve 10 as well. And her speech has been clear throughout the assessment. No slurring of words and good enunciation. Okay, so for cranial nerve 11, I'm going to have you lift your shoulders against my resistance. Very good. And then if you could turn your head towards my hand. Very good. And then turn your head towards that hand. Good. So that would be considered 5+. So you have good muscle tone of your trapezius and sternocleidomastoid muscles. So that would be considered 5+. And then finally for the hypoglossal nerve, for cranial nerve 12, tongue movements and speech. So again, we've already kind of assessed speech throughout this assessment, and there's no deficits. So now for your tongue movements, if you could push your tongue out towards your cheek against my fingers. Very good. The tongue movement is strong, not jerky. And then stick your tongue out, point it up, push it to the side, And the other side. Very good. So the tongue moves smoothly, there's no jerking, and it's coordinated. Okay, so now moving on to some coordination tests. I want you to flip your hands upside down and kind of go faster and faster with that. Very good. So I'm noticing the movements are smooth and not jerky. And now I want you to put your finger to your nose and then your other finger to your nose. Very good. And then I want you to put your heel to your knee and then run it down your shin. Very good. So again, smooth movements, symmetrical, strength, all of that is good. So I can have you stand up now. We're going to do the Romberg test. So if you could just get your balance, get nice and tall, and then put your hands towards your side. And then when you're ready, just close your eyes. Very good. No swaying, good balance. Okay, and now you can stand on one foot. You can hold my hands and then kind of get your balance. And then when you're ready, if you could put your hands down towards your side and close your eyes. Excellent. Okay, and then the same thing. When you're ready. Very good. Okay, so now I'm gonna observe her gait. So if you could walk towards the other side of the room. Very good. And then before you come back, I want to kind of get your bearings, and I want to have you close your eyes and then walk. So good. The gait is symmetrical, steady. And then now we're going to check sensation, okay? All right. So you can close your eyes and then let me know when you feel something.
Now. Yes. Yes. Yes.
Okay.
Yes. Yes.
Okay, great. And then, okay, I'm gonna have you stick your hands out, and then you close your eyes and tell me if I'm lifting your finger up or down.
Up.
Okay. Tell me if I'm lifting your finger up or down.
Down.
Okay, very good. And I'm gonna have you stereognosis. I'm gonna have you close your eyes, and I'm gonna put an object in your hand, and you tell me what it is.
A cotton swab.
Okay, you can open your eyes. And then close them again, and I'm going to draw a letter in your hand, and you tell me what letter it is.
A.
Very good. I'm going to do the other hand. I'm going to draw a number. You tell me what number it is.
8.
Very good. Okay. And then I'm going to take for 2-point discrimination, keep your eyes closed. You tell me if I'm touching with 1 or 2.
1, 2, 2, 2, 1.
Very good. And I can measure, it's only like a millimeter, so that's really normal for a 2-point discrimination. Okay, and now for your reflexes, I'm going to have you lay down to do your abdominal reflexes. Okay. And I need to be able to visualize the umbilicus. Okay, and so moving away from the umbilicus in the upper quadrants, I notice that the umbilicus slightly deviates towards the side that I'm touching. And moving down from the umbilicus, again, the same thing at the bottom. So the abdominal reflexes are good, and I can help you up. Okay, and the triceps reflex, I'm looking for extension of the arm. Good, 2+. And then the biceps, very good. And then the brachioradial, very good. These are all 2+ reflexes. And the biceps on this, or the triceps on this side. Very good. And for patellar reflexes, just relax your knees. Okay. All right, and then for your Achilles reflexes, just relax your foot. Good. Okay, and then I'm going to test sensation on the bottom of your foot. This might tickle a little. Good, and there's dorsiflexion. Okay, good, and that's an expected finding. And then obviously we would test sensation more carefully if you had diabetes, which you don't. And then I can also test for clonus by flexing your foot, and I notice there's no rapid rhythmic movements of the foot when I do that. Okay, and this concludes the neurological assessment. Thank you.